Hey guys, welcome back for our daily practice questions. As always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner and I'm the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, Q banks, flashcards, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know I always go over my disclaimer and reminder that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any other questions that you see here I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my videos where you may see things that I teach on that we do in practice currently, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states a 50-year-old female presents to the office with a 24-hour history of right upper quadrant pain, nausea, and vomiting. She has a fever of 101. On physical exam, palpation of the right upper quadrant elicits sharp pain, and she stops inhaling when you palpate below the costal margin. What is the most likely diagnosis? Is it A, acute appendicitis, B, acute cholecystitis, C, peptic ulcer disease, or D, hepatitis? Take a moment and tell me what you got. So, I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is being asked of you. Here, the stem of the question states, what is the most likely diagnosis? And y'all know I always say, if they're asking for a diagnosis, you need to run it back and look at the assessment findings. So here, this is a 50-year-old female, comes into the office, past 24 hours, she's had right upper quadrant pain, she has nausea, vomiting, she's febrile, and on exam, when you palpate the right upper quadrant, she has sharp pain. She even stops inhaling. So you know this is positive for Murphy sign. So this should confirm to you B, acute cholecystitis, right? Because we know Murphy sign is a confirmatory diagnostic exam for cholecystitis. But the key here is you need to make sure how to do the signs. So don't just know the name of the sign. As far as if they say a positive Murphy sign, you may know that that's cholecystitis. But what if they do it in this scenario and just explain how you actually conducted or explain the findings? You need to be able to identify both, okay? And so I do videos as well talking about that. But when you're studying, I want you to study it all together. So, I say in my video the other day, I was talking to y'all about how you study something and you feel like you know it, but you don't cover all bases. So you're studying it from a perspective of cholecystitis, right upper quadrant pain, Murphy sign, and you feel like you covered it, right? But then when they come to you from this point and say, when palpating the right upper quadrant, there was sharp pain noted, they stopped inhaling due to the pain, and now you're not able to identify that this is a positive Murphy sign. So when you study it, I want you to say, Murphy sign. Tell me what is Murphy sign, knowing which one is positive versus negative, so that you are able to answer the question no matter which way they pivot, okay? So again, the best answer is B. Question number two, a 24-year-old male presents with right lower quadrant pain, nausea, and anorexia that started 12 hours ago. On exam, there is tenderness at McBurney's point, and you note guarding and rebound tenderness. The patient also had pain when extending the right leg and a positive obturator sign, where there's pain when flexing and internally rotating the right hip. What is the most likely diagnosis? Is it A, acute cholecystitis, B, acute pancreatitis, C, acute appendicitis, or D, ectopic pregnancy? Take a moment and tell me what you got. All right, so stem of the question here states, what is the most likely diagnosis? So again, they're asking for a diagnosis, so you need to run it back and look at these assessment findings. So this is a 24-year-old male, came in with complaints of right lower quadrant pain, nausea, anorexia, and their tenderness at McBurney's point. This is classic presentation for what are you thinking so far? Appendicitis, right? So when you think about appendicitis, we think about right lower quadrant pain. We think about McBurney's point, the tenderness. We also think about rebound tenderness, but also the confirmation is the pain extending to the right leg, which is psoas sign, And then also it says positive obturator signs. So again, in this scenario, make sure that you know how the signs are conducted because they can tell you, like in this faction where they told you a positive obturator and gave you um, the steps to the maneuver, as well as how they just only listed the patient also has pain when extending the right leg. So when I put that there, that is for you to be able to identify that as a positive psoas sign. So one, knowing psoas sign and obturator sign, having positive findings for that is confirmation for appendicitis. The right lower quadrant pain, McBurney's point, is telling you all the key identifiers, but you need to be able to know those and know them completely. So the best answer is C. All right, and question number three. A 35-year-old female presents with right upper quadrant pain, nausea, and vomiting that began 12 hours ago. She has no history of similar symptoms. On exam, she has a positive Murphy sign. However, she also has tenderness in the right lower quadrant and fever. What is the most likely diagnosis, and what is the next step in confirming it? Is it A, acute cholecystitis, and you can confirm with an abdominal ultrasound? B, acute appendicitis, and confirm with a CT scan? C, acute pancreatitis, confirm with serum amylase and lipase? Or D, pelvic inflammatory disease, and confirm with a pelvic ultrasound? What do you think? So the similar question here states, what is the most likely diagnosis, and what is the next step in confirming it? So let's go back to the assessment findings, right? Because it's asking for a diagnosis. So a 35-year-old female comes in. She has right upper quadrant pain. So we're thinking right upper quadrant. So we're starting to think cholecystitis, right? She has nausea, vomiting. These are also classic key identifiers with cholecystitis. She doesn't have any other similar symptoms in her history. On exam, she has a positive Murphy sign. All right, this is confirming cholecystitis, right? But she also has tenderness in the right lower quadrant as well as a fever. So, with right lower quadrant pain, we begin to think appendicitis, just like we were discussing in the last question. But here, there's no confirmation of appendicitis. Here, we have the right upper quadrant pain. We also have a positive Murphy sign. So, this is most likely acute cholecystitis, but we want to confirm by doing an abdominal ultrasound. So, A is your best answer. All right, you guys. As always, I hope you found this helpful, but please be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. And y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the Nursing Studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to the Nursing Studio, the number one at gmail.com. All things that I do offer are linked in the bio of this channel, including the website where you can see all of the offers as well. But y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.